Welcome to the online course on pharmaceutical and medicinal chemistry. Module 2 of this course is drugs, nomenclature, classification, and administration. Chapter 2.2, Part B. In this module is drugs acting on peripheral nervous system and cardiovascular system. Part A, as you already know, is about drugs acting on central nervous system. Now we move on to part B, which is a chapter on drugs acting on peripheral nervous system and cardiovascular system. The instructor for this course is Dr. D. Shravani, Assistant Professor in Chemistry, St. Joseph's College for Women, Autonomous, Vishakhapatnam. Learning outcomes. By the end of this chapter, learner would be able to understand the meaning of peripheral nervous system, classify peripheral nervous system and peripheral nervous system drugs and recognize their role, comprehend the meaning and function of different categories of cardiovascular drugs, and also be able to mention an example for each category of drugs. Contents: peripheral nervous system and types of peripheral nervous system, drugs acting on sympathetic nervous system and parasympathetic nervous system, and finally cardiovascular drugs. What is peripheral nervous system? Peripheral nervous system is a nervous system which lies outside of the central nervous system. Central nervous system, as we already know, is brain and spinal cord. Nervous system, which is outside of these two, comprising of cranial nerves and spinal nerves, is what forms the peripheral nervous system. 12 pairs of cranial nerves and 31 pairs of spinal nerves form the peripheral nervous system. PNS includes the cranial nerves and spinal nerves. It is composed of the somatic and autonomic nervous system. In this chapter, we will pertain our discussion exclusively to the drugs acting on autonomic nervous system. Based on the chemical neurotransmitters that mediate autonomic nerve impulses, autonomic nervous system is subdivided into sympathetic nervous system and parasympathetic nervous system. What is sympathetic nervous system? Sympathetic nervous system connects the internal organs to the brain by spinal nerves. So, spinal nerves will carry the messages from internal organs to the brain. As we already know, it is a part of autonomic nervous system. That is, you have no voluntary control over that, and this particular system is what forms sympathetic nervous system. Any drug which modulates the sympathetic nervous system is called sympathomimetic drug. That is, it mimics sympathomimetic drug. These drugs are again of two types. One category of drugs are the stimulants, and the other category of drugs are the blockers. Adrenergic stimulants and adrenergic blocking agents. Adrenergic stimulants. These stimulants regulate adrenergic, or you can say the sympathetic nervous system is regulated by the adrenergic drugs. At times of stress, the impulses of the sympathetic nerves release the chemical compounds norepinephrine and epinephrine to the effector organs. The drugs whose action is similar to that of norepinephrine and epinephrine are termed as adrenergic stimulants. So the natural stimulants are epinephrine and norepinephrine. They are released at times of stress. So at times of stress, body has a mechanism by means of which it releases these two chemicals. Now those drugs which mimic these two chemicals and perform their function are called as adrenergic stimulants. Here you can see the structures of epinephrine and norepinephrine. Adrenergic stimulants are again of two types, beta 1 receptors or beta 1 receptor stimulants and beta 2 receptor stimulants. We know salbutamol is a drug, is a generic name for a drug which is given in times of respiratory distress. If a person is suffering from asthmatic attack or respiratory congestion, salbutamol performs the role of bronchodilation. It dilates the windpipe. So that salbutamol is an example of beta 1 receptor. Terbutaline is an example of beta 2 receptor. It works, it also dilates the bronchi or it smoothens the muscles lining the bronchus and the uterus. So it also causes a relaxing effect. You can see here the structures of salbutamol and terbutaline. Now we proceed to the blocking agents, adrenergic blocking agents. Just now we have seen stimulants are similar to epinephrine and norepinephrine. Salbutamol and terbutaline are the examples. They cause that relaxation effect or the dilation effect, and they perform the role of decongestion, especially in the respiratory tract. Now we look at the blocking agents. Adrenergic blocking agents are a class of drugs that exhibit their effect by inhibiting the action of the sympathetic nervous system in the body. They block or they inhibit the natural response that is generated through the sympathetic nervous system. Adrenergic blocking agents are again of two types. They are the alpha adrenoreceptor blocking agents and the beta adrenoreceptor blocking agents. Alpha blocking agents exert a vasodilatory effect, that means they dilate the blood vessels and lower blood pressure. Beta blocking agents, beta adrenoreceptor blocking agents also reduce blood pressure. They usually inhibit the action of catecholamines at the beta adrenergic receptor sites. We have seen they block that site, they enter that place, so the natural chemical cannot enter, cannot get locked to the receptor, so they block. And they are also used to control blood pressure. Action of catecholamine, they block the receptor sites of catecholamines, and so their action is inhibited, and thus they help in controlling blood pressure. You can see here examples, phenoxybenzaimine and propranolol. Now let us move on to the parasympathetic nervous system. In the sympathetic nervous system, we have seen the stimulants that are similar to epinephrine and norepinephrine. Then we have seen the blocking agents, which are blockers of catecholamine. They cause vasodilation and they also lower the blood pressure. Now we move on to the parasympathetic nervous system. Is a network of nerves that relaxes body after periods of stress or danger. When the body is facing some danger or some kind of stress, post that stress, it causes the relaxation effect. Parasympathetic nervous system is a network of nerves that relaxes the body after periods of stress. Drugs that stimulate the parasympathetic nervous system are called parasympathomimetic or cholinomimetic agents. Parasympathomimetic, that is, they mimic the parasympathetic system, or cholinomimetic agents. Acetylcholine or cholinomimetic. Acetylcholine is the chemical compound which mediates impulses between nerves and stimulates parasympathetic nerves. It's a mediator. It is a chemical which is released in between the nerves, impulses between nerves. There is a synapse in between the neurons. This particular chemical is secreted, and it stimulates the parasympathetic nerves. Parasympathetic sympathomimetic agents are again subdivided into cholinergic drugs and anticholinergic drugs, because based on whether they are acetylcholine stimulants or blocking ones, cholinergic drugs and anticholinergic drugs. What are cholinergic drugs? Cholinergic medications act upon the neurotransmitter acetylcholine, and they include cholinesters which act at all sites like acetylcholine. Acetylcholine has no discretion, it will act at all the places. So cholinesters also perform the same role, and the example is carbachol. Then of course you have the second category, alkaloids, which act selectively. The first ones, they are acting without any selection, just as acetylcholine. Alkaloids, they act selectively only on the end organs that respond to acetylcholine. Example is muscaine and choline stearase inhibitors, which inactivate the enzyme. These chemicals, they inactivate the enzyme that destroys acetylcholine, allowing the chemical transmitter to persist and produce intensified effects. If acetylcholine is allowed to exist for longer periods of time, it will produce intensified effects. So, there is a particular enzyme in the natural systems which will destroy acetylcholine. But acetylcholine stearase inhibitors, they destroy the enzyme or they inactivate the enzyme. If the enzyme is inactivated, acetylcholine will continue to exist for longer periods of time. Because it is existing for longer periods of time, it will produce intensified effects. And the example is neostigmine. So it is it is a choline stearase inhibitor. What is choline stearase? Is an enzyme which destroys acetylcholine. Now, because this particular neostigmine is inhibiting the enzyme, acetylcholine will continue to exist and it will produce intensified effects. Now, let us see the opposite ones, anticholinergic drugs. These drugs regulate abnormal muscular activity. Supposing, the muscular activity is uncontrollable or the muscular activity is going beyond limits. So the abnormal muscular activity to normal levels by preventing acetylcholine from producing an excessive stimulatory effect. That is, if the acetylcholine is producing so much effect that is beyond tolerable limits, then these chemicals are used to control that. Abnormal muscular activity is brought down to normal levels by anticholinergic drugs. These are also known as antispasmodic agents. Spasm is a kind of contraction and relaxation. Spasm, it is called. Antispasmodic means they prevent that spasm. So these are also known as antispasmodic agents, which are essentially anti-acetylcholine in action. The previous three examples are the ones that increase, or they are more or less similar to acetylcholine in their action, whereas these drugs are anti, that means they inhibit or oppose the action of the acetylcholine. The examples you can see here, papaverine and atropine are anti-acetylcholine anticholinergic drugs, and their action is anti-acetylcholine. Next, we move on to the last category of drugs, that are cardiovascular drugs. So far, we have seen what is peripheral nervous system. That is peripheral nervous system, which is outside central nervous system, comprising of cranial nerves and spinal nerves. After that, we have seen what is sympathetic nervous system and what are the drugs which act on the sympathetic nervous system. Then we have seen the parasympathetic nervous system, or the drugs which act on the parasympathetic nervous system. Now we move on to the last category, that is cardiovascular drugs. These drugs act on the cardiovascular system. Cardiovascular system essentially means the heart, arteries, veins, and the blood. and they are responsible for circulating blood throughout the body. Is also called as the blood circulatory system or simply the vascular system. Cardiovascular drugs are those which act on the heart or blood vessel. They either act on the heart or they act on the blood vessels. These drugs may be broadly classified into five categories: antihypertensive drugs, those that reduce blood pressure; then anti-arrhythmic drugs. That means if the heart is beating irregularly, arrhythmia. Rhythm is regular beat. Arrhythmia is the opposite. So these drugs are anti-arrhythmic, means they regulate heartbeat. And then cardiotonic drugs. Then you have vasodilators that dilate blood vessels. Anti-hypercholesterolemic drugs that control cholesterol levels. Now let us see what are antihypertensive drugs. We know hypertension is a common disease, and you can see here two blood vessels, one healthy blood vessel and a blood vessel. In a person suffering from hypertension, you can see the wall of the blood vessel in the case of hypertension is so thick, it is so broad, and you can see the blood vessel, the blood corpuscles, RBC, they're rushing out as a stream. Whereas if you see a healthy blood vessel, its walls are very thin, lumen is large, that is the tube is large, so the blood corpuscles are coming out at leisure freely. Here you can see they are coming out in the form of a pump, and the lumen also has become very narrow. And these are the medicines which bring blood pressure down in various ways. Antihypertensive drugs include ACE inhibitors, angiotensin converting enzyme inhibitors. So that enzyme is inhibited by these chemicals such that angiotensin is not easily converted to a chemical which will cause, which will cause heart attacks or which will cause hypertension. Then calcium channel blockers, they block, uptake of calcium such that the hypertension can be controlled. Then beta blockers and diuretics. Diuretic drugs help in excessive urination such that some salts will be lost and blood pressure can be brought down. Now, these are the examples of antihypertensive drugs: nifedipine and atenolol. Antiarrhythmic drugs, they make heartbeat regular or they control arrhythmia. Is defined as an abnormal rhythm of the heart. Heartbeat is abnormal. Then you can see here a normal heartbeat, regular graph, and here you can see irregular graph. The peaks are, so many peaks are there scattered. So this is arrhythmia. And many factors influence the normal rhythm or electrical activity in the heart. Diseases such as atherosclerosis, hyperthyroidism, or lung disease, they cause arrhythmia. So these are the conditions when there is atherosclerosis or a problem pertaining to the blood vessels, becoming thick, thick and hard, or there is hyperthyroidism. The thyroxine hormone is more than how much it is needed, and then you have lung disease like pneumonia or some, some form of tumors in the lungs or some congestion or some, then respiratory distress. Under those conditions, we experience or we notice the arrhythmia in the heart. That means irregular heartbeat. Antiarrhythmics are medications that prevent and treat a heart rhythm that is too fast or irregular. You call it as palpitation. When there is palpitation, the heart beats very fast. So that speed is controlled by these drugs. The commonly used antiarrhythmic drugs are procainamide and mexiletine. You can see the structures of procainamide and mexiletine. Next, we move on to the third category of drugs. They are the cardiotonic drugs. They're used to, tonics, tonics, they help or they help in the physiological process. Cardiotonic means they're helpful to the heart, used to increase the efficiency and improve the contraction of the heart muscle. They're helpful to the heart muscle. They enable it to perform up to the optimal level. which leads to improved blood flow to all tissues of the body. If the heart functions well, if the muscle performs nicely, contracts, then the heart will pump the blood into the arteries. Then all tissues in the body can get good blood, healthy blood or the aerated blood. Cardiotonic drugs are particularly useful in the treatment of congestive heart failure and associated edema. If the heart is not functioning properly, body will get edema, some kind of swelling. So these drugs are useful under those conditions, congestive heart failure and the associated edema. Cardiac glycosides are the ones that are helpful, or those are the drugs which can act as cardiotonic drugs. They are of plant origin and they are naturally occurring drugs which are more effective on the heart, and they are obtained mainly from the plants, and digitalis and digoxin are the most commonly used cardiac glycosides obtained from plants. So cardiac glycosides are a category of cardiotonic drugs obtained from plants which are helpful for the optimal functioning of the heart muscle. You can see the digitalis structure and the digoxin structure. Then we proceed to the fourth category of the circulatory system, drugs acting on the circulatory system. They are the vasodilators. Dilation means broadening or increasing the lumen. Vasodilators, they expand, or what you can say, they dilate the blood vessels, which open or dilate blood vessels. And ideal vasodilator drugs increase, because when the blood vessel is dilated, automatically more blood will flow into the blood vessel. Ideal vasodilator drugs increase the blood flow without increasing the load on the heart, or without increasing the work of the heart. They will dilate the blood vessels and more blood can flow into the blood vessel. Vasodilators affect the muscles in the walls of the arteries and veins. They don't affect the heart muscle. They work on the muscles lining the arteries and veins, such that a kind of dilation effect is produced and more blood can flow into the arteries and veins. They prevent the muscles from tightening and the walls from narrowing. If the muscles become tight, if the muscles that are lining the arteries and the veins, if they become tight, automatically they shrink or they get closer, and so the walls will become narrow and the lumen will become very narrow, so only less blood can flow in the blood vessels at high pressure. So these vasodilator drugs, they act on those muscles and they cause a dilation effect. The examples for vasodilator drugs are nitroglycerin and diltiazem. You can see here the structures of nitroglycerin and diltiazem. Finally, we come to the last category of drugs acting on the cardiovascular system. They're anti-hypercholesterolemic drugs. They control cholesterol levels. Simply, these drugs control cholesterol levels in the blood plasma. Cholesterol is a waxy, fat-like substance that's found in all the cells of your body. You can see high cholesterol, phase 1, phase 2, you can see that yellow lining. Phase 3, yellow lining has become more, and you can see phase 4, almost blood vessel is fully closed. Cholesterol control is important in preventing heart diseases or cardiac diseases. The drugs used to lower plasma cholesterol levels are anti-hypercholesterolemic drugs. So, what is the role of these drugs? What is the function of these drugs? They are used to control plasma cholesterol levels, that is, cholesterol in the blood plasma. The various drugs used for controlling the cholesterol levels are lovastatin and pravastatin, etc. You can see the structures of lovastatin and pravastatin. Thank you. All the images are sourced from Google, and we continue this lesson in part C, where you will learn about more categories of drugs, that is the hemopoietic drugs and the diuretic drugs. Thank you.